Recently, I've been hearing a lot of people talk about or maybe poke fun of LeBron James's feet, but what you may not know is his feet are actually pretty normal, and there's a reason he's never fixed them. Let me explain. Hey, what's up? Zach here. And as a foot doctor that treats a lot of athletes' feet, I've seen more of LeBron James's type foot in a week than anybody really should in their lifetime. But to understand LeBron's specific foot and what makes it function, first I kind of have to explain what he's got going on here, and let's start with the inside or medial side of the foot. First of all, LeBron's got a pretty moderate sized bunion, or hallux valgus as we call it. Most people think this is a bump on the inside of the foot, but what it really is this bone drifting toward the middle of the body because of loose ligaments, which actually buckles the big toe into moving the opposite direction. And then when you look at this as a whole with skin over top of it, it looks like a bump. And what you have to remember is this condition, or bunion, is hereditary. Yeah, wearing tight shoes can speed up the process. However, the underlying process is having a mom, dad, grandma, or grandpa with that same bunion. Otherwise, anybody that's ever worn a tight shoe would have one. The next thing you see moving across the foot is the second and fifth toes overlapping the others. A big cause of this, yeah, is that big toe pushing the second toe up. However, if you look at the tendons on the top of his foot, they're actually pulling all of his toes up and buckling all of them. You just notice in the second and fifth toe more. This process is called extensor substitution, and for a variety of reasons, the muscle and tendon units will fire more intensely than surrounding tendons, which over time pulls the toes up and becomes visible through the skin. This is also hereditary and has a lot to do with your foot shape, foot function, and how your muscles function as a whole up and down your leg. The other interesting thing about LeBron's foot is typically people with extensor substitution actually have a pretty high arched foot, whereas in LeBron's case, you can see his foot actually flattens out when he puts some weight on it. But in that same picture, you can also see that LeBron has a pretty flexed first metatarsal, which puts the head of that bone in contact with the ground for longer and with more force, which is another reason he runs the way he does. Remember, there's no such thing as a completely normal foot, just because everyone's foot's different. And I see a lot of things online saying, well, tight shoes are to blame, or his basketball shoes are to blame because when you're a baby, your feet are really flat and your toes are really wide before you start putting on shoes. But the problem with that blanket statement or argument is that the child's foot doesn't really start to take shape until at least 3 years old, when the midfoot bones start to show up. Until then, it's basically just a loose bag of bones. And because of that rapid development of bone when a child is in that toddler stage, it's really hard to tell what a child's foot shape is going to look like as an adult just by looking at x-rays, except for in really specific circumstances. But the million-dollar question, is LeBron's foot normal? Does it need surgery? And how does it affect his specific basketball or anybody with his foot types, basketball or other sports? Number one, yes, I think we established this. This is a pretty normal condition. And if you're not having any pain with this and you're still functioning at a high level, at least for you, then I don't see a reason to do surgery on this. Remember, the human body is a marvel at compensation, which means that depending on a million little factors going all the way up from your head down to your foot, your body is actually pretty good at evening out these little angular deformities that you may have. And in a lot of cases, especially with high-level athletes, the body actually performs better in its deformed condition. Just ask any track sprinter if they would want to have surgery on a tight Achilles tendon that's giving them a ton of push-off force. And in LeBron's specific case, if he were to want surgery, number one, it'd actually have to have this joint back here fused to get it back into straight alignment. Doing things up here in the head, especially for someone that's an elite athlete, would really result in potentially some scarring in the big toe joint, and you lose a lot of range of motion. Plus, this is just more durable of a procedure. That takes 6 to 8 weeks to completely fuse. Number two, he'd actually have to have a lot of tendon work done on the top of his foot with transfers and lengthenings to get the toes then to sit back down straight. Now, the problem with that is that's going to change the way his foot functions. That would mean he would have to retrain all those muscles to walk, run, and jump a different way, because now they're in different positions and functioning differently. Because LeBron's foot shape puts him in a lower center of gravity, which gives him really sturdy movement even in really awkward positions. This is also why his ball handling and footwork is so good in a crowd, and why his stutter stepping is so effective. So even though people make fun of his gait, it is effective. Because especially in basketball, a lot of your accuracy and precision with shooting comes down to just consistently using the same repeated movements over time. And when you then throw a wrench in there where just one leg is now firing its muscles differently, even just the small tendons in the foot, that can be enough to throw your timing off. And at his level, that actually has pretty serious implications. Plus, remember, 6 to 8 weeks of recovery, so now you're just sitting on the couch, getting out of playing shape, then you have to go retrain all those muscles to work in a different position. That's just a lot to ask of the body when you're playing at that high of a level. And lucky enough for LeBron, not only does he have his own signature shoe line, but his personal shoes, his player exclusive, actually are made from his custom last, which means they mold the shoe around his specific anatomy, which means it's going to increase his efficiency even more, especially if he's putting custom orthotics in them as well. And so when you look at LeBron's foot shape, function, and gait style as all one complete package, it gets really interesting to look at his sneaker choices. Because a lot of the basketball shoes in the LeBron sneaker line feature Air Max, and as a foot doctor, it actually makes a lot of sense to me for LeBron's foot. Because his toes sit up, it actually puts a little more pressure on the heel and ball of his foot. And LeBron James has no issues whatsoever in generating his own energy and generating his own push-off force to jump. He needs more of the shock absorption of Air Max. As we know, Air Max is great at shock absorption, not so good at energy return. But if you take anything away from this video, let it be this: everybody and every body is different, especially in your foot. Remember, your foot is absorbing so much shock and exerting so much force with every stride you take, especially with high-level athletics. And so right now, if you're looking down at your foot or any other body part or joint and wondering if that's normal, it's a great idea just to at least get a consult with someone who's a specialist in sports medicine, because they can really flesh out what's normal and what might be a problem later down the road. And that's exactly what Rafa Nadal, one of the greatest of all-time tennis players, is dealing with right now. So if you want to see what's going on with his foot and what he's doing to try to get back to the highest levels of tennis, make sure you click into the video up above and subscribe down below. I'll see you in the next video.